Hello, I hope you're doing well. Welcome to this class where we look at upper respiratory tract infections, focusing on laryngitis and sinusitis. My name is Winnie Berawa. If you're new in this channel, we focus on lessons, interviews, and lectures pertaining to healthcare. Don't forget to subscribe if you're new, and if you're coming back, please also don't forget to subscribe, but also you can join our membership segment. So let's keep up. In the previous class, where we were discussing rhinitis and pharyngitis, we explained that our respiratory system is divided into two segments, the upper respiratory segment and the lower respiratory segment. And in this, we said in the upper respiratory segment or tract, we have the nasal cavity, the pharynx, and the larynx. And this is where we are going to focus and channel our lessons more around these particular areas. So most of the illnesses that we're going to discuss in this class are therefore going to be based around these diseases that we've highlighted here: rhinitis, pharyngitis, sinusitis, laryngitis, tonsillitis, adenoiditis, epiglottitis, and COVID-19. So if you've not watched our previous lesson, please refer so that you can learn more on what we said about rhinitis and pharyngitis. So let's dwell in and learn more about the two diseases that we are focusing on today: sinusitis and laryngitis. Sinusitis. Sinusitis is an inflammation of the sinuses, whereby it can be originally due to a direct infection, or it can be a secondary infection from a different part of the respiratory system. Now, before we go into details, let's remind ourselves what sinuses are. So sinuses are normally air pockets or air spaces in our facial bones, and what they do is they help us in lowering the weight of our skull so that we can easily balance it. And we have different types of sinuses, or what we call the paranasal sinuses. So we got the frontal sinus here, we have the ethmoid sinuses, we have the sphenoid sinuses, and the maxillary sinuses. So usually these sinuses are empty or filled up with air, and this air is what is going to balance our pressure in our skull bones. But unfortunately, they can get infected and it can undergo a process we call inflammation. Inflammation process, it's a very irritating process, and normally it leads to effects such as production of fluids in form of mucus in the respiratory system, and it can fill up the sinuses. Unfortunately, some of them can end up getting blocked, or the openings of our sinuses can end up feeling blocked, and it can cause different symptoms for our clients. So diagnosis, here we are looking at which procedures can we do to enable us to check our sinuses. So we can have nasal endoscopy. This is a procedure which you can use an endoscope to check how the sinuses are like and to explore how bad the blockage could be. We can go for CT scan, or we can collect sinus samples to just check the bacteria or the microorganisms that are present through culture and sensitivity procedures. If you're still not understanding about diagnosis, you can refer to videos we've done around respiratory diseases investigative procedures, where we've looked into invasive procedures, non-invasive procedures, and the special procedures that are usually done for respiratory illnesses. So that can give you like detailed information around it. You can just refer to our playlist on respiratory disorders, and that will give you more varieties to look into. So then, if a client has sinusitis, what are the clinical manifestations you expect to see? So the client will complain about pain around the facial areas like the eyes, the cheeks, and even the forehead. Mostly they'll talk about headache, which is common because you can see the spread out of our sinuses. Sorry, you can see the frontal sinuses are actually on the forehead. The ethmoid and sphenoid are around our nasal bones, and then we got the maxillary sinuses, which are around our cheeks. So these areas of the pain areas are spread out on that because it's reflects on the locations of the different sinuses. But then there'll be nasal discharge that will be present. The client also will complain of nasal blockage due to the mucus production that is in the sinuses. You can have postnasal drips, fever or increase in temperatures, and then you can have bad breath. So now, because of the nature of the sinuses, because we know it's a closed space, it's expected to have air, but now it's filling up with mucus, and the client will present with so much itchiness and unsettling or irritability. This is due to inability to access these spaces and be able to either scratch or clear as effectively as they could have done in cases of rhinitis. So therefore, when it comes to management of sinus, it's a little bit more like how we will manage the other upper respiratory tract infection, but there's more focus on how to ease the congestion. So for instance, we encourage us to have rest because this client also can have malaise or general body weakness. So the rest is to help us conserve energy, but to also allow the body to adapt to the symptoms. There's also adequate hydration. The hydration purpose is to help us with clearing of the mucus or the fluid from the sinuses. This is where hydration or fluids ensures that we are able to loosen up the thickness of the mucus so that it becomes more watery, it can flow easily, and the viscosity is reduced so that mucus can easily come out. So that's why we encourage hydration in these regards. But also we allow humidification. Humidification has the same effect as hydration. It's going to reduce the viscosity of the mucus or the fluids. It's also going to make it flow out easily, and it's going to clear. Now, when it clears, it ensures that the congestion gets to be reduced from our nasal spaces. But then we have use of antibiotics. Commonly, we talk about amoxicillins, which are really good. They are broad spectrum and they can clear majority of the microorganisms that could be causing our sinusitis. You can also give antihistamine in case you're worried about allergic symptoms like sneezing and itchiness, which are really good at clearing such. Use of warm compresses to just press around the sinus areas. This can also, help us with temperature regulation, but they are also good at helping us, open up the sinuses, ensuring that the mucus is able to flow out and all that. Pain is good to help us ease up the headache episodes, to ease up the general pain due to the inflammation and redness that is happening in the sinuses. So we encourage pain management majorly because of that. Moving forward, we got laryngitis. Now, laryngitis is from the word larynx. In larynx, we simply call them vocal cords, and these are known for producing sounds, vocalizing, talking, singing, name them. Any activity we do that requires us to produce sounds, we are going to use the larynx, commonly known as vocal cords, but also in layman's language, we call them the sound box. So laryngitis in therefore is the inflammation of the vocal cords, also known as the larynx. Major causes of laryngitis could be due to viruses, it can be due to bacteria and fungi, but also you can stimulate laryngitis or inflammation of the larynx due to presence of irritants or in clients where they have acid refluxes or in cases where there's overuse of the cords. Like if you talk for so long, they can get stretched out and they can end up getting inflamed. But also maybe you expose yourself to too much singing for so long, it can also, expose them to such reactions. So just to refer on to understanding the anatomy of the larynx. So the larynx is located above the trachea, but it's also below the pharynx, and it's normally surrounded by cartilages to just support it and to keep it well stabilized. So the vocal cords are known for regulating, the sounds. You can have loud sounds, low tones, different variations. But then if these vocal cords get infected or they get affected by different factors that you're mentioning here, like presence of irritants, like allergic irritants, presence of microorganisms like bacteria, fungi and viruses, presence of an acid reflux, or misuse or overuse of the cords, then they can get inflamed and they can swell. So when this happens, then our client can start showing signs and symptoms of laryngitis, and this you are saying is inflammation of the vocal cords. So laryngitis is known for presenting with three main Ds. Now, when someone asks you, can you describe the three main Ds of laryngitis? Here we talk about one D is known as dyspnea, the second D we call it dysphonia, and the third D is dysphagia. So you can see them here. So when you're asked to describe the three Ds of pharyngitis, we are referring to dyspnea, dysphonia, and dysphagia. But we shall come to that. So let's focus on the clinical manifestation one by one. So with a client who has laryngitis, he or she can present with sore throat. This is simply the tenderness, the swelling, and all these symptoms that show around the throat that usually makes it very painful, uncomfortable, and really irritating when this client is trying to perform their normal physiological functions around the larynx. But also the client can present with symptoms of cough. We can have difficulty in breathing, where we talk about the dyspnea. Then you can have hoarse voice. Now this is where we talk about dysphonia, where the production of the sounds is not clear, it's struggling, and this client is not able to pronounce words properly. Then you have persistent cough or irritation around the throat area. This fatigue or feeling of generally feeling tired or malaise or general body weakness. Then you have the aspect of difficult or painful swallowing, and this is what we are calling dysphagia. But then you can have a global sensation, a state where you feel like a lump is present around the throat. So that heaviness of a sensation around the throat in form of like a big lump that is based on the throat, then that you should also expect it, and you can describe it as a global sensation. The client can also present with fever and chills or high temperatures, mainly because this being an infection-related kind of issue and an inflammation cause, then you can detect some state of fever or increased in temperature in the body. But now let's look at how long does it last, and how do we diagnose, and then how we manage our condition. So acute laryngitis is known for lasting for less than 3 weeks, and normally it can just resolve on its own. However, if you look at chronic laryngitis, it can exist for so long, more than 3 weeks, and the symptoms can further persist if no interventions are done. So when it comes to diagnosis or investigations that we can do to check and confirm the presence of or the diagnosis of laryngitis, then we can do culture and sensitivity. We can use laryngoscopy, or we can do laryngoscopy, that is direct examination of the larynx to just check the status of the spread of the condition or the development of the condition. There's also biopsy. So this is cases where you're worried about cancer-related illnesses or tumors, and so you can do biopsy to just collect samples to examine them further. So in the management, because we know that larynx are known for production of sounds, therefore it means for us to heal our larynx, then we need to rest the voice. We need to rest the larynxes. So how do we do this? We need to avoid unnecessary talking or singing to just allow the cords to rest and to heal. But then you can get aspect where you can do adequate fluid intakes. So hydration is critical because it allows us to prevent any status of dehydration, but also it's going to help us clear any mucus. It's going to help us, loosen up any fluids that have been produced, and they can easily be cleared off. Then avoidance of irritants such as smoke, pollutants, and even dust, because we understand that irritants are known for prolonging the feeling of inflammation, and the inflammation can worsen the presence of pharyngitis. So we can look at avoiding these irritants for the purpose of just eliminating the inflammation episodes. You can also do pain management through availing of analgesics or painkillers that can just help us clear the pain and ensuring that the vocal cords are not strained. Antihistamines can become really handy if you're worried about allergic symptoms or allergic kind of symptoms like itchiness, sneezing, and such. You can also do antimicrobials or large spectrum antibiotics or medication that can clear large number of microorganisms. But if you want to directly clear and alter the environment around the larynx to just make sure we don't support further growth of microorganism there, then you can do warm salty gargles. These are home remedies that are easily available and you can make them on your own. However, it's advised that you don't do this with children. Remember, children may not be able to control the gargles and they may not understand how to do that properly, so you avoid gargles to avoid choking for the kids and to avoid unnecessary blockage. So this is one, the prioritized management that you can do for laryngitis conditions. So what about complications? So for the complications, we have already mentioned them before. So in here, we're going to just mention them or list them one by one. But if you're looking for detailed reference on the complication, we've done this in the first chapter or in the first lesson where we were discussing about pharyngitis and sinusitis. And in there, you will see how we've explained how all these illnesses come up. So to list them, we have number one, lower respiratory infections, for instance, pneumonia, atelectasis, and so on. Then under secondary bacterial infection, we can have development of otitis media, mastoiditis, pneumonia, exacerbation of asthma, and chronic obstructive pulmonary disease, or what we normally call COPD. Can also get case of meningitis, sepsis, peritonsillar abscess, rheumatic fever, and also nephritis. So these are possible complications that come up with upper respiratory tract infections. But again, I repeat, if you need detailed explanation of how all these illnesses come about, we've done this comprehensively in the first lesson or the first part of upper respiratory tract, where we are discussing sinusitis and pharyngitis. So thank you for being with us all the way to the end and encouraging you to please like our video, comment, give us, a review. What do you think about these videos? Are they nice? Are they something you can learn more? Share in your platforms and also subscribe. So thank you so much and see you in our next lesson. Bye bye.